Good morning. My name is Victoria Lancy. I'm the Rural Education Manager for Michigan Center for Rural Health, and I would like to welcome everybody to our MACR, MIPS, and APM's education series. And our topic this month is Overview on MIPS. Just a few reminders. If you are logged into the webinar portion and using the link provided, you can listen to the audio through your computer speakers, or if you are just participating via the phone, don't worry, because we are recording the webinar and it will be posted on the MCRH website. Our website is www.mcrh.msu.edu. Click on the resources tab across the top, then click on the quality payment or QPP section, and then there all of the recordings will be posted. If you would like to ask a question during the presentation, you can type it into the chat feature so you don't forget it. Otherwise, you can ask your question during the Q&A component at the end of the program when I unmute the lines. With that, I would like to introduce our speakers from Hall, Render, Killian and Heath, Brian Bauer, and Lisa Lusudo. Go ahead and take it away, guys.
Well, thanks, Victoria, and good morning, everyone. This is Brian Bauer with Hall Render. And this is the second in our MIPS QPP series. And again, we're doing one a month, and the focus is to prepare you and provide you with the tools so that you avoid a negative adjustment and hopefully actually have a positive adjustment. And so we've broken it down to do 12 presentations. The second one, this one is focusing on a more detailed overview of MIPS. So what we're going to cover today is a high-level understanding of the MIPS program: who's included, who's exempt, how to participate, performance thresholds and payment adjustments, and how to achieve at least 15 points. You'll remember that under the MIPS program, there is every single provider that's covered by MIPS, and we'll get to that in a minute, will receive a performance score for each year. So it's not a cumulative over a number of years, or gee, you get one score and you keep it forever. Each year, based on the reporting that you do that year, you get a performance score. Then your performance score is matched against the performance threshold. If you're above the performance threshold, you get a positive adjustment. If you're at the performance threshold, you have actually no adjustment. And if it's below the performance threshold, obviously then you have a negative adjustment. And so what the performance threshold is for this year's reporting and 2 years from now, so 2020's actual payment adjustment, the performance threshold is 15 points. So again, throughout the course of our presentations, we're going to be focusing on making sure that we provide you with the tools so that you get or score, and your performance score is at least 15 or higher, so that you avoid any sort of negative adjustment. So MIPS, history of MIPS, we're not going to spend a lot of time on this, but basically MIPS sunsets 3 old, or as Medicare refers to them, legacy programs, combines them into a single program, or sunsets them and replaces them is the way I tend to think of it. It's the PQRS system, the Physician Quality Reporting System. Everybody's familiar with that. The Value-Based Payment Modifier, and also the Medicare EHR Incentive Program. So those 3 programs are being sunsetted, and MIPS takes its place. And so just to kind of make sure that everybody's on the same page as everyone else, when we're moving through the MIPS program, MIPS, the first reporting year was actually 2017, so last year. So that reporting, the last data report was March 31 of 2018 for the 2017 performance year. That will drive payment reimbursement adjustments in 2019. So that's set. So what we're looking for and focusing on is our performance year 2018, which will drive reimbursement adjustments for 2020. So MIPS has 4 categories. So in some ways, I always like to cover the history, PQRS, value modifier, but you really have to, and especially the EHR, just get that out of your mind. That's the old way, MIPS is the new way, and we have 4 performance categories. Quality, cost, which we really don't have any reporting obligations for that. That's something that CMS gathers the data simply from claims data. Improvement activities and advancing care information. So points from each of these categories are added together to give you your final MIPS performance score. And as we said a minute ago, or I said a minute ago, the MIPS final performance score is compared to the MIPS performance threshold, and above positive, below negative, right at the same, no adjustment at all, or a neutral payment adjustment. So here's how the 4 categories are weighted. And I'll say this is the general overarching MIPS weighting. There are some adjustments depending on if you're an alternative payment model or an advanced alternative payment model, but the generic MIPS model is this model, which is 50% or 50 points is based on the quality, 10 on cost. Again, that's data that CMS compiles or retrieves from claims data. Improvement activities, 15 points, and advancing care information. That's the focus on electronic health records and electronic reporting. That's 25% of the score, 25 points or potential points, for a total of 100 possible final score points. So who has to participate in MIPS? Excuse me. So who has to participate in MIPS? Well, basically the current eligible clinicians are physicians, physician assistants, nurse practitioners, clinical nurse specialists, and certified registered nurse anesthetists, CRNAs. Those are right now the clinicians that are covered by MIPS. Now, CMS hasn't given us any specific detail. The plan has always been to expand that to other categories of clinicians, for example, physical therapists. But right now, first 2 years, it's all focused on physicians, PAs, nurse practitioners, nurse specialists, and CRNAs. Now, clinicians can participate either individually or as a part of groups, and we'll get into that a little bit more here in a minute. And they can participate in that fashion across all 4 performance categories. Now, one of the things that's changed for this year as opposed to last year is the low volume exception. Medicare and MIPS has always had this exception that, or position that, if you are a low volume Medicare provider, then you're not subject to MIPS. 2017, that threshold was $30,000 a year in Medicare billings, or 100 Medicare beneficiaries per year. For this year, the standard has gone up, so we will actually have more providers, clinicians that qualify, or I should say are accepted from MIPS as low volume providers. That threshold for 2018 is individual clinicians or groups billing less than $90,000 a year, or that have fewer than 200 Medicare patients a year. Those are going to be low volume clinicians, low volume groups, and they are not required to participate in MIPS. All right, so who's a physician? That's always important. MDs, DOs, that's probably universally understood and accepted. But it also covers doctors of dental surgery, doctors of dental medicine, doctors of podiatric medicine, optometrists, and chiropractors. So I think if you think of the context of if you get a payment under the Medicare physician fee schedule and you have a doctor in your name, you are going to be covered by MIPS because you're going to be considered a physician. So who's exempt from MIPS? We know all the classes of or categories of clinicians. We know the categories of physicians. So here's who's exempted after that broad inclusion, who's exempted. Newly enrolled in Medicare. So if you're a physician who is graduating from residency program this June and you start practicing in July or August, you're not going to be covered by MIPS for the 2018 reporting year. That's not going to start until 2019. There won't be any positive, negative adjustment. It'll just be a neutral adjustment in your revenue just because you just don't have a full year in the program. So it doesn't start for you until 2019 reporting year. Or in theory, any other reason that if you were newly enrolled in Medicare this year, you're not going to be covered by MIPS reporting for this year. We've already talked about the low volume threshold. Also, if you are participating in advanced APM, there's really two categories of APMs. Lisa's going to talk more about this. There's what's typically referred to as a MIPS APM, which would be track 1 that doesn't have sufficient risk to qualify for an advanced APM, and advanced APMs. The advanced APMs, if you receive 25% or more of your Medicare payments or see 20% or more of your Medicare patients through the advanced APM, then you're not covered by MIPS. Now, the one thing that I want to point out here is it's not always easy to tell at this point in the year whether you're going to be a low volume threshold provider or group, so you're not covered, or if you're going, so, you know, knowing now in May whether at the end of the year you're going to have more or less than 90,000 in Medicare receipts or 200 or more fewer Medicare patients for this year. If you're close to that line, or if you're in what you think or maybe qualifies as an advanced APM, but you're close to that 25% or 20% line, you need to be at least thinking of how you're going to report on the quality metrics, the EHR or advancing information metrics, and practice improvement metrics, because if you get towards the end of the year and you're just over the 90,200 or just under the 25% or 20% in the case of the APM, you're going to need to then do your reporting. So, and it doesn't carry over from year to year. So if you had 26% of your Medicare payments through an advanced APM last year, you know, there's no guarantee that it's going to be at that same level this year. So don't lose track of that and the fact that you may still need to report under MIPS if you're close to that line. RHCs and FQHCs, payments to RHCs and FQHCs are also exempt. RHCs and FQHCs are paid under an all-inclusive payment methodology and not under the Medicare physician fee schedule. So most of the payments from Medicare to FQHCs and RHCs for the clinicians that provide services through those organizations are not impacted by MIPS or exempt from MIPS. The only thing that I, again, caution and point out is physicians and clinicians and FQHCs and RHCs sometimes bill under the physician fee schedule for some services. Now, if it's below the low volume threshold, you know, below the 90,000 or the 200 patients, then you're going to be fine. But if you're in an FQHC or an RHC and you do bill under the physician fee schedule and you are over that threshold of $90,000 or 200 patients, then you're going to have reporting obligations as well. If you have reporting obligations because you exceed that low volume threshold, even though you're in an FQHC or RHC, and you don't report, you'll get a score of 0. You'll be under the performance threshold of 15, and you'll get the maximum negative adjustment for 2020, which is 5% negative adjustment. So just keep in mind, even though generally FQHCs and RHCs don't need to worry about this, if you bill under the physician fee schedule, you need to be sensitive and conscious of that. How to determine eligibility, MIPS eligibility. This is really kind of a cool website. If you haven't gone on it yet, I would encourage you to do so. You just click on it and you get a screen comes up, you enter your 10-digit NPI, and then you get a chance to see your performance or your participation status is really the right way to say it under MIPS. Now, if you are in a MIPS ACO, specifically if you're in a ACO Track 1 MSSP ACO that doesn't qualify as an advanced alternative payment model, when you go to this website, there'll actually be a different link because this link will not show your participation and your participation status as a MIPS ACO. So, but it's a great tool. If you haven't used it or tried it yet, I encourage you to do so. All right, I always get questions about critical access hospitals and method 1 versus method 2. How does this impact it? Does it even apply? Some people have, when I tell them, yes, MIPS applies to CAHs, they're like, oh, how does that work? I mean, you know, we get cost-based reimbursement. Well, the fact of the matter is MIPS is going to apply to the professional component, not to the facility component. So if you're a critical access hospital, method 1 or method 2, please don't think you're accepted just because your facility payment's not going to be impacted. Please understand the professional component still will be. So you need to be, unless you meet that low volume threshold, if you're in a critical access hospital, MIPS applies to you, including your ED docs and other hospital-based physicians. So how does it work for critical access hospitals? Well, the MIPS payment adjustment would apply if you're billing method 1 for physician services or clinician services. MIPS payment adjustment would apply to the payments made for item services for the Medicare Part B services. Think of it as the professional component, and the adjustment would not apply to the facility payment. So the MIPS score will make a difference. It will impact how the professional component is reimbursed. And then for method 2, in this case, method 2 for physicians who have reassigned their right to bill to critical access hospitals, it just straight up applies. So the MIPS payment adjustment would apply to the method 2 payment. Yes, I understand that the whole beauty of method 2 is that there's this percentage bump up. Well, but the percentage bump up, you think of that as your payment. Any sort of negative adjustment or positive adjustment is built on that bump up. So even though under method 2, you think, all right, I get a bump up in my fee schedule because I'm billing method 2, think of that as the base, and then the MIPS adjustment up or down will be based on that bump you already get under method 2. But the important thing to understand is you got to be doing the reporting and planning for the reporting, because MIPS will apply to you unless you're you're small enough that you meet the low volume exception. And then for clinicians participating in a method 2 critical access hospital who've not reassigned, well, in that case, your payments are coming directly to you, but understand it is still subject to MIPS, is still subject to the MIPS reimbursement adjustment. And it does, you need to be thinking about how we're going to report, whether you're reporting as a group with the other physicians at the critical access hospital, whether you're reporting individually. Either way, it's going to impact your reimbursement. However, CMS will not make payment adjustment to the CAH based on the clinician's performance. So the critical access hospital payment under this model does not get impacted, just the professional component. So with that, I'm going to turn it over to Lisa.
Thank you so much, Brian. So I'm going to talk about, we're going to kick off the second half of this presentation about how do you participate in the MIPS program. And there are a couple of different options. The first being reporting as an individual. So if you choose to report as an individual, you'll be reporting under your own MPI and tax ID, so your TIN, where you reassign your benefits. Otherwise, you can choose to report as a group. CMS has defined a group as 2 or more eligible clinicians under your own MPI who have reassigned your billing rights to a single tax ID number. And a new concept that was introduced for MIPS reporting year 2018 is the virtual group. This is another option that you may have to participate in the MIPS program. And I'll talk a little bit more about what it means to be in a virtual group in the next slide. And Brian and I will also get into some further detail on the virtual group concept in later presentations. So what is a virtual group? CMS has defined a virtual group. It can be made up of solo practitioners, and it can be made up of actual physician groups of 10 or fewer eligible clinicians. These clinicians and groups come together virtually. It does not matter what your specialty is. It does not matter where you're located physically. And you come together in order to participate in MIPS for a single performance period. So it's a very interesting new concept. It combines individual eligible clinicians, it combines groups, and you come together to form one single group, and your scores will be aggregated together. So you are reporting as if you are one single group. To be eligible to join or form a virtual group, you'll need to be a solo practitioner, but you'll have to exceed that low volume threshold, so you're included in MIPS reporting as an individual. You can't be newly enrolled. Additionally, if you want to join a virtual group as a group, you'll have to be 10 or fewer eligible clinicians, and you as a group have to exceed the low volume threshold at the group level. So if you choose to participate in MIPS as an individual, you'll obviously be reporting your data as an individual. So what this ultimately means is that your payment adjustment will be based on your individual performance. So you will have your own individual MIPS score at the end of the reporting year. You'll need to send your individual data for each of the MIPS categories through EMR or a registry. You can also send in quality data through your routine Medicare claims process. So for 2018, you'll be able to pick from a list of different ways to submit your data, and some of these options that we've included in our slide below will vary based on what performance category you're reporting data on. So the quality performance category will have a couple of different options to report data in that category. And as I mentioned, some of the data will be collected through your routine claims process. There's no additional steps. Some of it will be collected through your EHR that you have in existence and in place, but other data might need to be reported through a registry. If you choose to participate in MIPS as a group, then you obviously will be reporting your data as a group. And this means that your payment adjustment will be made on the group's overall performance. So the group will receive at the end of the reporting year a total MIPS score. Again, similar to reporting as an individual, groups can choose from a list of available data submission mechanisms. Again, some of these options will vary based on what performance category that you are reporting on. And below is just a list of some of those options of how you can report your data. So this slide outlines some of the changes that were made to the performance threshold and payment adjustments compared from 2017 performance period to 2018. And the biggest takeaway here is the increase in the minimum 3-point threshold for 2017, which has now increased to 15 points for reporting year 2018. Again, as Brian mentioned, it's very important, and we're going to emphasize throughout the rest of our presentations, that you achieve at least that bare minimum 15-point threshold. This will ultimately mean you will not be hit or dinged with a negative payment adjustment. In 2017, that threshold was a little lower. You only had to get 3 points to not be dinged under the MIPS program. Now that bar is set a little bit higher, and you have to get to at least 15 points. The next threshold actually did not change from 2017 to 2018, and this is the exceptional performer threshold. So you'll need to get at least 70 points in order to be considered an exceptional performer under the MIPS program. Obviously, if you score more than 70 points, you're going to receive that positive adjustment to your Medicare Part B physician fee schedule payments, which is great. And you may also be eligible for additional exceptional performer bonuses as well. So it would be, this is the gold standard. If you get to 70 points, you're looking at a positive adjustment, and additionally, you'll be eligible for an additional bonus payments. Finally, the last change from 2017 to 2018 is the change in the payment adjustment standard. So for 2017, there was a variable of positive or negative 4% for your MIPS total score. So your fee schedule payments could potentially, if you score really well, be positive 4%, and if you don't participate at all and you scored 0, then you would get negative 4%. That has increased to 2018, 1 percentage point, so you're looking at now a positive or negative 5% adjustment to your fee schedule payment. This slide kind of details a little bit further and breaks down the payment adjustments and the thresholds from 2017 to 2018. So again, you can see at the top, if you score 70 or greater, that has remained the same. That's the exceptional performer standard. Again, you're eligible to receive additional performance bonuses if you score in this category, and you'll also receive that positive adjustment to your fee schedule payments. The green box you'll see is that minimum threshold, where it was a neutral payment adjustment, or you weren't going to get dinged or affected by MIPS if you scored at least 3 points in 2017. Again, you can see that's increased to 15 for 2018, so really critical that you score at least 15 points at a bare minimum, so you're not going to get hit with a negative 5% payment adjustment. If you didn't participate at all in 2017, you will receive a score of 0 points, and you will automatically get that negative 4% payment adjustment to your Medicare Part B physician fee schedule payments. For 2018, same, if you don't participate at all, you'll get a score of 0. You're going to get that negative payment adjustment. That is just now increased to negative 5%, so you're getting hurt a little bit more in this reporting year. Additionally, if you just don't do well at all and you only score 3.75 points, you're going to get that negative 5 payment adjustment as well. And then the next category, you can see if you score between 3.76 and 14.99, you're going to get a negative payment adjustment. It may not be negative 5%. It's going to be somewhere between 0 and negative 5%. So really critical, again, that you get at least 15 points. Obviously, our goal is to get you above that threshold, but at least achieve 15 points so you're not going to get dinged on your Medicare Part B payments for 2020. So CMS in 2018 for this reporting year has introduced a couple of new bonus opportunities that we're going to walk through in a little bit greater detail. The first is the small practice bonus. And if you qualify as a small practice, you will automatically receive 5 bonus points that will be added to your final MIPS score. And this will apply to eligible clinicians or groups who are participating in a small practice. CMS defines small practice as 15 or fewer clinicians. And another key critical component of getting this bonus is that you submit data on at least one performance category during your applicable performance period in MIPS. So it's really important you submit data in at least one performance category. If you're participating in MIPS, you'll be doing this anyway. So the reality is there's really no extra work necessary to achieve this bonus if you do qualify as a small practice. And CMS recognizes that small practices face, administrative burdens in trying to report this data and collect this data. They just don't have the resources to do it. The burden and threshold is a little bit more challenging for these types of practices, and CMS recognizes these challenges and will automatically give you that 5 extra bonus point bump so you can successfully meet the MIPS requirements. The second bonus opportunity is called the complex patient bonus. This is also new in 2018. You may be eligible to get up to 5 bonus points if you treat complex patients based on their medical complexity. That is measured by your HCC risk score and a score based on the percentage of dual eligible beneficiaries. MIPS eligible clinicians, again, or groups must submit data on at least one performance category in the applicable performance period in order to get this bonus. So CMS here recognized that if you just have a complex patient population that maybe has a lot of chronic illness or disease, it's going to be harder for you to achieve higher scores and do well under the quality metrics just because your patient population is so critically ill and complex. So this is a way for you to be able to be eligible to get 5 additional points, and so that you're not automatically facing those challenges and going to be dinged under MIPS just because your patient mix is just so critically ill. So this is great for practitioners who are eligible for MIPS that have a patient population that is medically complex. So the next slide will outline some of the key dates that you need to be aware of for the MIPS reporting year 2018. As you all are probably aware of, the performance period for this year opened up on January 1. It will close on December 31st. So during that time frame, you're expected to be collecting your data. The next very significant deadline is March 31st, 2019. This is the deadline for you to submit your data that you collected during your performance period in 2018. CMS will take that data, they're going to evaluate it and calculate what your final MIPS score is. Based on whatever that number is, your payments will be impacted effective January 1, 2020. So your Medicare Part B payments will be impacted and the adjustment will either be positive, negative, or neutral starting January 1, 2020 for the services that you performed in 2018. So this slide, as we've talked about, will detail how MIPS is a kind of sliding scale in terms of your upside and downside risk. So if you do well, there's opportunity for upside risk. You know, you can be eligible to receive that positive adjustment. That's really great for revenues. It's great for patient quality outcomes. That blue bar that's running through the middle of the vertical arrows is where the neutral threshold lies. So for 2018, think of that as the 15-point constant where you want to be at a bare minimum, so you're not receiving a negative payment adjustment. And as you'll see from year to year, CMS has increased the threshold in terms of the positive or negative adjustments. So for 2020, as we've mentioned, it's positive or negative 5%. But for the data that you collect and the services you perform in 2019, that will impact your 2021 Part B payments, and that goes up to positive or negative 7% and onward, as you can see. So very important and significant that you understand what the MIPS program entails, collecting the data, and at least achieving a score of 15 points so that you're avoiding any sort of negative payment adjustment to your Part B payments. So with all this being said, what does this mean? What happens if you just decide, this isn't for me, it's too much work, I'm not going to report anything? It could go 2 different ways. So if you're exempt from MIPS, if you truly are exempt, and Brian talked about some of the exemption criteria, so that being, for example, you meet the low volume threshold or you're newly enrolled in Medicare, there is no consequence for you if you choose not to participate then. However, if you are not exempt from MIPS and you fail to report at least the minimum amount of information for 2018, you will automatically receive the full 5% penalty on all of your Part B payments starting January 1, 2020. So the impact of you choosing to do nothing is quite significant, and it's very important that you recognize that. And as I mentioned in the prior slide, the penalty will go up from year to year. So if you choose in 2019, this isn't for you, you're not, even if you're a MIPS eligible clinician and you're supposed to participate, you just choose not to, that penalty will go up to negative 7%. Again, important to note, as Brian mentioned, this is not cumulative. So with that being said, your MIPS score won't be dinged at a cumulative amount if you choose not to participate. The clock resets. However, it's still important that you recognize the penalty is significant and it increases from year to year. The penalty for years 2022, CMS has not yet decided those penalties, but we expect they'll presumably remain at that minimum of 9%. And with that being said, I'm going to turn the conclusion over to Brian.
Thanks, Lisa. So just a quick slide here to show you what we're going to cover in the upcoming presentations. The next 4 months, we're going to take a little bit deeper dive and unpack the specific requirements for each of the categories: quality, advancing care information, improvement activities, and then the fourth category, cost, because as we mentioned, there's not as much direct impact on that because none of the providers, none of the covered clinicians that are required to participate in MIPS actually do reporting under the cost category. But we believe there are some things that you could be looking at and thinking about and actually doing in your practice that have an impact on that cost category. So even though you don't specifically report anything, it's all coming out of your claims data. We do think there's some things you should be thinking about, and we're going to talk a little bit more about virtual groups that Lisa introduced us to today. Then we'll spend a little bit more time in October talking about virtual groups, because generally when you're under or when you're participating in a virtual group, there's a virtual group agreement everybody has to sign. Those really need to be in place in October. So we're going to talk about that a little bit, make sure that you get the information you need so you can, if you choose to participate through a virtual group, you're able to know what you need to do and make sure you do it successfully. And then we're going to start covering all the categories and talking about reporting. As we get to November, December, January, and actually all the way through to March, through the end of March next year, that's when we report the data in each of these categories. So we want to, again, on each month, drill down a little deeper and talk a little bit more about the specifics of reporting for that specific category. Again, just to equip you with what you need to make sure that you're able to submit the data to maximize your performance score. So with that little summary or preview, Victoria, I'll turn it back to you for any questions.
Thanks, Brian and Lisa. So everybody, if you have a question, I will start unmuting our lines, or you can please feel free to use the chat box. So all of our lines are unmuted. So if you have a question, please feel free to ask your question, or you can use the chat box if you have a question or comment. I always find these presentations very enjoyable. Brian and Lisa, it's always a great presentation and such a great overview of everything that we need to know about MACRA and MIPS. So thank you.
Well, thank you, Victoria.
Thank you so much, everyone.
If you can't think of a question or a comment right now, please feel free to reach out to me, and I can always pass it along to Brian and Lisa if you have a question. And it looks like they've also left us with their contact information, so you could always reach out to them personally if you have a question for them that you don't feel comfortable asking on the line. Okay, doesn't look like we have any questions or comments, so we'll go ahead and sign off. Thank you for everybody for joining us, and have a great day.